Hello, I'm Dr. Jeff Sessions from Lake Oswego, Oregon. We're a suburb of Portland, Oregon. I'm an orthodontist, and I'm going to show you two common problems that happen in orthodontic offices with patients that they can remedy at home. So this is a model. I won't have Amy home in on it yet. This is a model with coil springs, and almost every orthodontist utilizes these somewhere in the course of their treatment. These coils that are meant to create space are wrapped around the wire, and the most common problem is just the very end of this, and I'll show you in a minute when I have Amy home in, but that little end can kind of unwound a little bit, and it can poke the lip, and it can feel very much like a needle, and it can rub your lip raw over the course of a couple days. A less common problem, but it does happen, is that coil comes unwound a lot. And again, in a minute I'll have Amy home in on it, but when it comes unwound a lot, it is really harsh on the lip, and you really need to either come in to see me, but if you're out of town, or if you're away on the weekend and you don't have a convenient orthodontist, then you need to know how to take care of it yourself. So, the more common one is, and at this point I'm going to have Amy home in on the spring. Okay, so I'm going to compress this spring, and you grab it with your finger and just kind of compress it like a jack-in-the-box, but I'm going to have her home in and see that pokey end there. Can you see that, Amy? Are you homed in enough? Good. Anyway, one way to do it is to compress it and then spin the spring and rotate it and then let go of it. Hopefully the video showed it, but now it's no longer touching the lip. But I'm going to compress it and spin it back out so that you can actually see the pokey end. But you just compress and rotate and then let go, and that pokey end is now away from the lip and it's no longer sharp. But if that doesn't work, or if it keeps reoccurring, because sometimes the spring over the course of eating, over the course of a couple days, will rotate right back out. Method number 2 is, and I'm going to have Amy home in, but I'm going to flip this around because it's easier to use my nail clips this way. But you take a pair of common nail clippers, and I'm going to go in there and I'm going to snip that little pokey end, and you're going to hear it snip. Anyway, now it's no longer a pokey. Now, let's go over to the left side where the spring came dramatically uncoiled. I'm going to compress it with my hand, take my nail clippers, just standard nail clippers, and I'm going to snip it right there. This is an awkward angle. I probably should rotate the model around, but I'm going to snip it. I'm going to rotate it around, make my life easy here. But let me compress it. But you're going to cut that with the nail clippers again, and make sure that this little piece doesn't go flying. But I know this is probably hard to see in the video, but it's easier done in the mouth than it is here. But you snip it, and that goes flying away, and it takes care of it. So, common nail cutters, and I didn't snip through, but it's super easy to snip. But nail clippers will snip the little short pokey end, or it'll snip the dramatically pokey end, and take care of your problem. Thank you.